Hi everyone, this is Dr. Billy. Today we are going to talk about something you might not know about dentists. I'm sure you all had this experience before. You went to a dentist. Before the dentist even looked into your teeth, you were bombarded with a lot of questions. Questions like, what's your name? How old are you? Where do you stay? What do you do? Where do you work? Have you had any surgery done before? Are you on any medication? When was the last time you see a dentist? Do you floss? You might think that we are trying to do a matchmaking for you, trying to get a new husband or wife for you. But the truth is, we really need to know those information to deliver a very good treatment plan for you all. For example, we ask about your work. Let's say if you have a very busy working schedule, we will try to arrange the treatment that does not require you to come so often. We will probably give you a longer appointment time so that we can try to get as many things done as possible in one visit. And let's say if you have an easier working schedule, we probably will split up the appointment so that your visit to the clinic is not that stressful, a shorter appointment time. The reason we ask about your medical history, about your general health, is because our oral is also part of our general health. There are certain things that we have to be careful. For example, high blood pressure, diabetes. Some of these situations does not allow us to do certain dental procedure. The more detail we know about your medical history, the safer it is for you. And on the dental habit and dental history, the reason why we ask about that is because most of the dental problem does not happen overnight. It usually happened quite a while ago, and because of certain habit, over time it developed into a current problem. So it's important for us to know about your dental history and also your habit so we can find out what exactly caused the problem so we can solve it in a better way. And last but not least, in dentistry, we are not treating the teeth, we are treating the person. So the reason why we are trying to have a conversation with our patients is because we want to build a relationship, a rapport with the patient so that we gain the trust from the patient and we can communicate better with our patients. So these are some of the reasons why we ask many questions to our patient when the patient comes and see us. So next time when you see a dentist, if the dentist is asking too many questions, do bear with him or her for a while. He's just trying to do his job. But of course, if there are some information that you don't want to disclose, you can tell them that you don't want to let them know. And now the restriction has been extended for another 14 days. While staying at home, try not to just sleep and eat, sleep and eat, sleep and eat. If you can, try to do something. For example, reading a book, learning a new skill, or do some preparation for your work. For me, I try to learn how to make video in a more efficient way over the last 1 or 2 weeks. I think if I didn't do that, my life would be really boring. So that's about it for today. If you like the video, do share with your friend and follow our page. And I'll see you soon.